Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Here is what I bring to you from the world of medicine. Maternal antibodies may interfere with malaria vaccine responses, study finds. Maternal antibodies passed across the placenta can interfere with the response to the malaria vaccine, which would explain its lower efficacy in infants under 5 months of age, according to research led by the Barcelona Institute for Global Health in collaboration with 7 African centers. The findings published in Lancet Infectious Diseases suggest that children younger than currently recommended by the WHO may benefit from the RTS S and R21 malaria vaccines if they live in areas with low malaria transmission where mothers have less antibodies to the parasite. We know that the RTS S/AS01E malaria vaccine is less effective in infants under 5 months of age. But the reason for this difference is still debated, says Carlota Dobaño, who leads the Malaria Immunology group at Barcelona Institute for Global Health, a center supported by La Caixa Foundation. To investigate this, Dobaño and her team analyzed the blood samples from more than 600 children and infants who participated in the phase 3 clinical trial of RTS/AS01E using protein microarrays. They measured antibodies against 1000 Plasmodium falciparum antigens before vaccination to determine if and how malaria exposure and age affected IgG antibody responses to the malaria vaccine. The analysis of antibodies to P. falciparum in children who had received a control vaccine instead of RTS/AS01E revealed a typical exposure signature with high levels in the first 3 months of life due to the passive transfer of maternal antibodies through the placenta, a decline during the first year of life, and then a gradual increase as a result of naturally acquired infections. In children vaccinated with RTS/AS01E antibodies induced by natural infections did not affect the vaccine response. However, in infants, high levels of antibodies to P. falciparum presumably passed from their mothers during pregnancy, correlated with reduced vaccine responses. The higher the level of malaria transmission, the more maternal antibodies are transmitted to the baby, resulting in lower vaccine effectiveness. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.